Dr. John Lieurance is going to speak at our Ultimate Wellness Conference at Faena Forum in Miami Beach on September 26, 27, 28, three-day longevity conference where we unite this holistic approach to our health with the most advanced and selected biohacking technologies, therapies, and products. Stem cells, they are in our body. We naturally have them, and the thing that they decline with aging. That's why we want to have these more advanced therapies, stem cell therapies, to promote our health span.
At this point, I think stem cells has been around long enough where people know, like, hey, that would be a good idea, right? And so now it's a matter of like, how do you pick the right person to go to, right?
In right clinic, right doctor. It's the same as with hormonal replacement therapy. That's right idea have been around for a century or even more. Now it's only question which doctor we consult with, and probably the same with stem cell therapies.
Yeah, I mean, it's like it comes down to two real, I think, basic things: is the doctor, right? The doctor himself, not the clinic, because I wouldn't recommend people go to anything that's like a franchise, because it's hard for those types of businesses to hold down really quality talent, because somebody that's really good is going to be working for themselves, right? As a doctor.
Yeah.
You want to look for a doctor that's, he's got a clinic, and you want to also make sure that they use ultrasound guidance. It's a big deal because you need to not only see what's wrong in the body, but you got to be able to like guide. It's called needle guidance. So I wouldn't do it without that.
As far as I know, we have those stem cells which come from your own body, and another way to get stem cells, it's from embryons or some donors. And you have very good experience with both variations, as far as I understand. I have seen on your website. So now, after many years of experience, first of all, explain what is the difference between each of these two approaches, and what do you suggest to get those stem cells?
Well, we started out in the beginning, this is going back quite some time, but we would do liposuctions on patients, and then we would also take their bone marrow. And we were actually taking, because if we saw really severe cases, we want to give that patient the best option to heal, like a really advanced arthritic knee or something like that. So we found combining the bone marrow with what's called the adipose stem cells, right? So there's a whole family of stem cells where we would add an enzyme to the fat after we would do a mini lipo, and it would break up the fat, and then we would centrifuge it, which means spin it really fast, and we would collect what's called the stromal vascular fraction. And that was basically the name of like these 120 plus types of different stem cells. There's like all these different types of stem cells all together. And so it's like a whole food of this natural symphony, right? So all the different stem cells do things that are very unique in order to have certain types of healing scenarios that you might find that would be ideal for certain things, like whether it's hair or skin, or if there's like sexual rejuvenation, like treating ED or vaginal wall atrophy and things like that, with different types of issues with urinary incontinence. It could be really helpful for. And then you have orthopedic, right? And there's different types of orthopedic problems and different structures. And then you have you can run it as an IV, right? And so you might have neurological, we have a brain protocol where we have specific ways that we apply the stem cells so that it's for the brain. Yeah. So you have to choose where it's going to go. But the rejuvenation, if you do as an IV, goes throughout the whole body. In Korea, they did a study, and they were able to show that it extended life by about 30% by doing this IV.
how often do you recommend to do this IV with stem cells?
I have some people doing it once a year, and I have some people doing it like once a month. If somebody's just doing it for anti-aging, right, or somebody might be doing it for cancer, like one of the things about the X cells is what we were talking about, where now you don't have to get a mini lipo, right? You can we get these off the shelf, and they're usually from donated fat from young vetted females that have been tested. And so when patients come in, we can actually mimic like what was working so powerful, the most powerful out of everything that we'd ever done. And this is only in the last year and a half that we've been able to utilize something, and it's FDA cleared. There's a number of studies. The FDA is like heavy oversight over all of this process of them even making these stem cells. So they're very safe. We call them X cells. And they're basically
so those X cells, they come from donors. Cells, they come from donors.
Yeah. Mm-hmm. If somebody's listening to this, they can go to xcell.us, and we have like some studies that we kind of talk about. And so the alternate is most doctors are using placental derived stem cells.
Yes, I thought that it's now the most common and most recommended, but now you say that your X cells, they come not from placenta.
I would say if people are interested in longevity with stem cells, to work for long periods of time, but they would want to look more towards X cells. Placental stem cells are more like a flash. Like there is a more powerful like short-term effect, right? But you're only talking about a short period of time, just a few days, maybe a couple of weeks. So the effect with the X cells is that they continue to work for like 2 to 3 months, like they're actually like working. And so because of that, you can produce a lot more cartilage. Like we noticed when we would do before and after MRIs, thick cartilage with people's hips and their knees. I wouldn't even expect to get results on a really bad hip case if I used a placental stem cell, unless I did it like a lot. You did a lot of.
Okay.
No one really wants to spend.
What are other specific characteristics that make these X cells superior in comparison with those cells, stem cells, which we derive from placenta? What are the characteristics?
Oh, they're safer.
Safer? Okay.
They're safer because they don't produce cancer. They actually can produce the opposite.
Yeah. I also saw this application for stem cells that they can reduce or prevent cancer. So is it true for those X cells?
It's these cells called MUSE, M-U-S-E, right? It's MUSE stem cells. We actually started using MUSE exosomes with some of our cases. So some of the cases we're blending exosomes, and the MUSE exosomes are really interesting, but the MUSE stands for multi-generational endurance stem cells. And so they last a long time, but they happen to have like this anti-cancer effect. So if someone had cancer, there would be an argument that maybe this might mop some of that up. That's my thoughts based looking at the research. To me, I would say that you're going to have like almost a Pac-Man effect where it's going to kind of gobble up cancer cells. So you could actually treat cancer, and we've had cases that we've done some IVs with it that have had a cancer diagnosis where you wouldn't even dream of doing that. Someone, because even if you suspect there's cancer, you might not want to receive the placental stem cells because of the danger.
Yes, exactly, because it boosts growing some tissues, some cells, and it's believed that if you boost the growth of cells, you potentially can boost the growth of these cancer cells. So that's why it sounds very logical that stem cell therapies are not recommended if you have if the patient has cancer. But now what you are saying that with these X cells, it's opposite and it can be recommended.
We've actually injected these into prostates.
Okay.
Prostate cancer is the second leading cancer in men over 40. I mean, it's a really big deal. Like almost every guy, I would say, after the age of 40, has a chronic infection in their prostate and they don't even know it. And the only way to diagnose it is by testing the semen. We send the semen to this company that does this next generation sequencing, and it tells us not only what infection they have, but which antibiotic works against those infections. And under ultrasound, we do a series of 3 injections to clear up the infection. But like, literally, this is the reason that men are getting hypertrophy. It's not from testosterone. It's from a chronic infection. And cancer happens with this prostatic hypertrophy over a long enough period of time. It stresses those cells in the prostate. And so then they go cancerous. So this is really the problem is, I think men need to start recognizing that this infection exists, and I'm hoping through my foundation to make more education to the public about this, so that because I think this is a problem that should be solved pretty easily, but nobody's talking about it.
Yeah, it's true. Education on this in such cases are very important for females, for male health, and I think it would be a good topic to discuss at the Ultimate Wellness Conference.